Now I would like to introduce our guest speakers today. Brandy Jensen is the Director of Programs and Services at the Brain Injury Alliance of Iowa, and she leads the Neuro Resource Facilitation Program, a team of facilitators to provide resources and advocacy to Iowans affected by brain injury. Brandy has been a certified brain injury specialist since 2010. And Stacy Freeland is a Government Relations Director with the American Heart Association and has been with them for over 6 years. She has worked on a variety of policies, including improving stroke care in Iowa. So thank you all for participating today, and I will go ahead and let Brandy and Stacy get started.
Thanks so much for joining us today, everybody. We really want to see this type of thing go on longer, a partnership between the Heart Association and the Brain Injury Alliance. And this is a great picture of your brain here that we're going to talk a little bit more about today. When we talk about different kinds of brain injury, there's of course the acquired brain injury or the traumatic brain injury. And this is really where it comes into a play, stroke. And we really have seen an uptick in the amounts of stroke, 5.3 million Americans that are affected by this, by a traumatic brain injury. And then, of course, stroke is classified as a brain injury. And so when we talk today about, the number of deaths that are happening, this is kind of an older statistic, about 1,627 deaths. We also are getting a really huge uptick in the amount of young stroke survivors in the state. And that, to us, is something that we need to take into effect when we're talking about handling stroke patients and how the best way to try to get them back to as much of a normal life as we can. Stroke affects all different types of the brain, and it definitely impacts who that person might have been before, what kind of profession they might have been in. And as you can see from the screen, and the different areas of the brain it can impact. And some people have just all kinds of different types of quality of life afterwards. There may be a severe disability that they encounter, and the family members are also working with them on trying to get them working together in the family. If they have children, being able to care for those children again. But all different types of things happen when somebody encounters a stroke. Physical changes, there's all kinds of cognitive, but there's also emotional and behavioral, and then psychosocial, and we're going to talk a little bit more about what those particulars are. Some of the physical changes, I know that's something that, you can see on the outside. Nobody really knows about some of the internal changes that happen with stroke patients. There's just a little bit more slowness and sensitivities to maybe sound and light. They may have dizziness that they encounter and headaches, and get really tired from doing just day-to-day types of activities. That means that adjusting that type of, what their activities may be, allowing more time and making sure that there's easier access to different places in your house. If you have, the capability to really try to dim down your lights, if you're going out and doing different activities, trying as best you can to minimize too much bright, shiny lights that are going on. Really trying to keep as much noise down to a minimum, which I know I have kids, so sometimes it's challenging, and I know some stroke patients are challenged by that as well, but just trying to keep those factors a little bit on the lower side. I know we have stroke patients when we bring them up to the Capitol that bring, some ear protectors for the sound, because it can be a very noisy place, and those are kinds of things that I know patients and families look out for when they are going out and about. Again, with dizziness, you got to make sure that there's obstacles out of the way so that falls don't happen, and because then you'll have maybe even some severe, like, broken bones and all kinds of things. So really making sure that that patient is protected. Also, just always making sure that you have a little bit of Tylenol in the purse when somebody's going out and about, in case those headaches arise. and really building in, if you're going to have some kind of event with patients, or if you guys have an outing that's going on, just making sure that they have those breaks and naps, and really keep on that, because they might need those breaks that they might not have had before that stroke. A lot of times there needs to be a little more focus of having the multitasking is really difficult sometimes with some patients. Limiting distractions is definitely important, and I have an office that is pretty out of the realm of I keep the lights very dim, and that's another thing that maybe that environment, if they have a little room in the house, that you can have it be the kind of quiet room, and have the lights be dim so that they can go in and have the time to really kind of focus and regroup. That's always important, and that's kind of really important in the process. There's definitely cognitively, there's all those kinds of challenges of slow thinking and reading. And, really, if you're, the caretaker or someone who might work with a stroke patient, just remembering those things when you're having those conversations and having them, have that time to really kind of really think through what they're going to say next. That's just important for a patient as they're talking with you. That processing speed to, when you're talking, really try to calm yourself down. Sometimes I have a tendency to talk really too fast. So you really need to think and allow them the time to think and respond, and let them have that time. Don't try to force conversations to happen at a fast pace. They really have to have the processing time. And always try to help them as much as possible as you're talking through things, or if you're filling out any paperwork with them. That is important so that they understand completely what is going on. I know that some of the patients that we've worked with before, sentences may not be grouped together, and they, might need that time to really organize that communication, and just, a lot of times you just have to think a little through what they're saying, because that is really, they know what they're thinking in their head. It just might not come out that way. So that's just another thing that with working with patients, and if you're that stroke patient, that recognize that in yourself. There's all kinds of different things that you may have to be repeating some things, trying to prep some things ahead of time for patients, and if you can work through an agenda, that's always important. And asking those yes or no questions is also another really important factor, because they may not have the ability to do a full sentence when answering. Definitely, you want to do some more, if there's some new information that you're presenting, there's definitely an impact on memory. It may be even from the past, something they may have remembered. They may have been a nurse beforehand, but some of that information may be lost after that brain injuries happened with that patient. So if there's new information taking into effect, that you might have to go through that slowly. Cheat sheets, I know that was always outlawed in school, but in this case, this is important to have a little bit of a cheat sheet, just so people can stay on track of what might be asked of them, and keeping those new information pieces really small and concise is important, as we stated earlier in the earlier slide. So this is just a little kind of picture of how somebody may function after a stroke. It can be a maze of trying to navigate through all of those things that might arise for a patient, and how they're impacted by that stroke. Keeping things a little more black and white and clear, and not getting into too much abstract conversation is always good, and keeping things organized that way. As somebody who works with patients, having that plan and strategy ahead of time with how to organize the conversation for them, and that kind of thing is important when you're working with patients. So now we'd like to turn this over to Nicole, who wants to talk a little bit about stroke and the rehab process.
Okay, so I'm Nicole Shane. I'm the stroke program manager at Mercy in Sioux City. And Stacy has asked me to kind of talk a little bit about our stroke rehab and the importance of support groups, especially once you get out of rehab. The first thing that my stroke survivors are always pushing and pushing for everyone is this is a lifelong process. When you first go in and have your stroke, your doctors tell you, you know, you're going to get about a year, and what we get in a year is what you're going to get. And that's absolutely not the case. Research only goes out to a year. And you know, some of the progress steps that the stroke survivor sees happen the quickest in the first year. But that rehab process goes on through the entire life of that patient. And we have to remember that once they stop doing therapy, that they'll regress. So it's really important, even if they're out of official professional therapy, that they continue to do those exercises and continue to try to get better. We also see that these stroke survivors, they'll plateau out. So they'll be at the same level for a while, and then if we start challenging them again, they'll start making improvements again. So it's really not just when you're an acute inpatient in just that year, it's forever. And the other thing one of my survivors is always telling me is never stop. You can never ever stop doing all this. You have to keep pushing through rehab. The benefits of rehab are improved mobility. We see people going from, you know, bed bound to wheelchair bound to being able to walk, to walkers, to canes, to walking independently. Improved quality of life. Anything that they can get back improves their quality of life. Increased independence. You know, a lot of these people come out of their stroke completely dependent, and with therapy and rehab and things, they can become mostly independent. Improved function. Also the improved ability to communicate with people, because we know that aphasia affects a lot of people, which is Stacy spoke about earlier. So rehab is vitally important to our patients, our stroke survivors and their families. And rehab can be anything from a long-term acute to a skilled level to an acute rehab to outpatient therapy. And patients might move through all of those levels of rehab. Support groups is the other thing Stacy really wanted me to speak on. So support groups traditionally have been very rigid in their structure, and we found that our support group had fizzled out several years ago. So a year ago, we started a new support group under a new format, and what we found is we have a lot of very young strokes, unfortunately. So your support group needs to be welcoming. It needs to be an open environment where everybody can come. You need to include the entire family. It's just not the stroke survivor that had the stroke. The entire family had to have the stroke together, and there's a lot of changes that go on within that family dynamic, and you have to serve the needs of all of those people. Really helps if you have snacks. We need to provide support for everyone. We sometimes have support group all together, and sometimes we have two separate sessions at the same time where families and caregivers go one way and survivors go another way so they can work out their problems. And it needs to be open and informal environment. We sometimes go in with an idea that we're going to talk about one thing and we get there and that's not what the group needs. I also found that it needs to be on a time that's good for people that are working. When you have young stroke survivors, their families are working during the week a lot of times, so ours is always on a Saturday from 2 to 4 because that's what time fits for people that are working. So it's really important to keep those things in mind, and we average just 1 year into it, 20 to 25 people in our stroke support group every month. So that's a huge number of people. If you're not aware of stroke support groups, they're usually very small numbers. We add more people every month too. So just by following those simple things, you're going to see a lot more people coming to support group and getting the support they need. Benefits or support group. I actually called some survivors and their spouses and asked them, what has our support group done for you? The biggest things was it decreased the feelings of desperation and isolation among not only survivors, but also their spouses, because they feel like they're the only ones going through this. They have an increased feelings of empowerment. We started taking them to the state capitol and doing lobbying and working to try to get stroke care improved in the state of Iowa. increased awareness of resources. What one survivor has gone through, there's a new survivor starting to go through, and for them to be able to reach out to each other and provide each other with that has been huge for them. Increased socialization. Our survivors now have a face group page that they all work on together. They go out for meals together. If one of them's struggling, they're sending text message, emails, and phone calls to help each other through it, and a sense of purpose. Our survivors are feeling like they have more to do now. They're not just trying to get better. They're able to help and provide purpose to the society, which is really big for somebody that's young and was working full-time and doing all of these things prior to having their stroke. And then Stacy asked me to talk a little bit about Stroke Camp. So we have teamed up with Retreat and Refresh Stroke Camp, and you can visit their website at strokecamp.org. But we now host a stroke camp on the western side of the state. And it's really a time, it's a weekend, really retreat and refresh weekend for both the stroke survivor and their spouse and or caregiver. From the time they get there until they leave, they don't have to do anything other than get themselves bathed, do their ADLs, take their meds. Other than that, we provide everything for them. In fact, at one point during our weekend last year, the spouses went and took a nap, and they said, I haven't had a nap since my spouse had a stroke 2 years ago. One spouse hadn't had her fingernails painted in over 2 years. She's, you know, in her 30s, and she hasn't had time to paint her fingernails for over 2 years. She had time to sit down and get a manicure. Those kind of things, and allowing those survivors and spouses to just be together but not have to worry about taking care of anything is huge for them, and it helps the spouses rejuvenate for the next year. A component with the Retreat and Refresh is a Strikeout Stroke baseball game, which we have teamed up with our local minor league baseball team. We have one game a year where we go and we really push out the message of stroke as an emergency, the signs of stroke, risk factors for stroke. We have helicopters and ambulances and fire trucks coming in to really push stroke out as an emergency. And then another component of it is a 5th grade education to try to teach prevention and recognition of stroke with 5th graders. So we've incorporated all this, and the great thing about all of this is the survivors are involved through all of this. So we have survivors out educating 5th graders. We have survivors out doing the Strikeout Stroke and doing the education for stroke, and it helps them really get a sense of purpose, and I can do things again in society, not just sit at home, be disabled, which is a huge deal for them. And I think that's it. So I will turn it over to Stacy and Brandy, and if anybody has any questions at the end, I'm more than happy to answer them.
So this is kind of some of the emotional and behavioral changes that may happen with a patient, and if you're a patient out there, you may know this very well, some of the different things that you're going through. There may be impatience, of course, with the delay in speech that you go through. There's emotional control, anxiety, depression, all of those kinds of things that a patient may be going through. And either if you're a caretaker, if you're a patient, these kinds of feelings you're probably very well informed on. There's all kinds of challenges that that patient may be having to work on even after that they've never had before, whether it might be depression or anxiety. And, you know, there's that trying to have action steps and, you know, not real clear on your self-awareness and cognitive abilities. That those kind of things can be challenges that you might have as a patient, and that Nicole, once we can get her all set up here, we'll talk about a little bit and how rehab really helps with addressing some of those things, and so that support from that peer-to-peer to talk through some of those challenges that arise day to day from doing everything. That reassurance, I think, is you as a caretaker. If you're a caretaker out there trying to work with your family member or friend, trying to give that reassurance to them as they're going through maybe rehab and coping with after the stroke. and trying to be calm as best as you can when you're going through those kinds of processes, and giving them the time that they need to really try to cope with what they're trying to go through. So as Nicole was saying, support groups, they're very, very critical. And here is a list of all of the support groups that our stroke task force has listed on their website. And if there isn't one in your area, please contact myself. I can try to figure out and contact the hospital in your area to see if there might be one that's not listed. But they are really great options, and I know I've learned a lot by going to Nicole's support group. I think it's amazing work that's happening with those patients and those families. And the other option that I know that the Heart Association, Stroke Association has, if you don't have a support group that's in your area, is our support network. And it's really an online type of support group that people can access, and because sometimes they may not have the time to go and meet in person, or they may live kind of in the middle of nowhere, Iowa, kind of like most of Iowa. So there's lots of benefits to it, just a lot like what Nicole is going through, that encouragement and reinforcement, not feeling like they're alone. Because sometimes there are some patients that are alone, that may not have a really vast support network. And this is a place that they can go and really get out some of their frustrations, get some questions answered, all of those kinds of things that are really, really important, especially with trying to get back to where they may have been before stroke. We have seen all kinds of great outcomes when it comes to quality of life with patients of stroke. That is definitely a risk factor of getting them back as much as possible to a healthy life and a healthy quality of life, so that they're not facing all kinds of other issues that may arise from not getting the help that you need. Like if you're suffering from depression or anxiety, getting that support and maybe medications that may help you through that type of that new type of diagnosis that you may be facing. And really, it's also an option for those caregivers and loved ones to also have some support out there and talk to amongst other caregivers. That is a really important factor too, because they, like Nicole said, also suffered the stroke and are trying to get some sort of normalcy back in a family. This is just a little bit of information about people that have used this before, a couple quotes. Definitely there's people who feel like this is a blessing to really have that online support that they need as they're going through their stroke journey, and being able to, even if you may have lost a loved one due to stroke too, there's those kinds of supports that are out there within this network. So it is specific by the type of stroke that you have had, which is nice, because then people can even answer questions for that different kind of stroke that you may have occurred with you, and that's kind of nice because it's specific to what you may be dealing with your stroke. There's also questions answered, which is nice, and having that support that way, because if you are having something that you don't want to go to the doctor just one more time on, this might be another option for you to have that question out there and have that addressed with a professional. There's also blogging. I know blogging is huge these days, and this is a specific way to blog with fellow people who are going through the stroke journey too, and patients and families and doctors. So that's another feature. The other group that I wanted to that everyone know about is the Stroke Task Force. They've existed for quite a few years now. They are a group of stroke coordinators, the stroke associations involved, the Iowa Department of Public Health. All of these people have gotten together to really try to improve stroke care in our state, and we've done a lot of amazing things through that stroke task force, and there's a lot of great resources that are on the website, so I highly encourage you to visit it. Those support groups are listed on there, as well as all kinds of information that you might have. So I believe this is my last slide, so I'm going to turn it over to Brandy right now, who's going to cover some more information that Brain Injury Alliance has.
Thank you so much, Stacy and Nicole, both, for that valuable information. I'm just going to talk a little bit about the Brain Injury Alliance of Iowa and how we are a support to individuals affected by stroke, in addition to individuals affected by a variety of other brain injuries. So our, as you can see here on the slide that I have up, we're basically a statewide organization that's dedicated to assisting families, survivors, caregivers that have been affected by brain injury, and helping them access information. We focus on advocacy, education, prevention, and really just spreading information across the state about awareness of brain injury and the effects that it can have on families and the resources that we have available. We're a chapter of the United States Brain Injury Alliance, which is a larger national organization that focuses on getting information and education to families that are affected by brain injury. So we're one of several states, a 21-state region that has this same mission. And so a little bit about our programs and services and what we do. We have a core program called our Neuro Resource Facilitation Program, which is what we are funded to do largely. That is a program that allows us to have 6 resource facilitators here in Iowa that take calls from folks around the state and help those individual families and survivors get connected to resources, programs, information in general that will meet the needs of their call. We don't require any sort of documentation or proof that they've had a brain injury. We're really just, we're kind of meeting them where they're at when they call us. And so we help them get connected to whatever resources might meet their need. We also do a variety of education in the form of these educational webinars that we do. You can take a look at our YouTube page. We have a lot of archived recorded webinars focusing on a lot of different topics related to brain injury and how it affects people. We also host a large conference in March in Des Moines every year, and we do a variety of smaller regional conferences periodically throughout the year as well. We've been involved in some research in collaboration with our relationship to Mayo Clinic, and another big piece of what we do is advocacy. So we assist callers directly and do that one-on-one advocacy for whatever individuals might need assistance with. And we also do more of a systems advocacy approach as well. And so we work with other leaders in the state, disability leaders, and develop some policy and legislative initiatives and agendas annually to really focus on what Iowans affected by brain injury need in Iowa to live better with brain injury. And so we work on that. We have a lobbyist at the Capitol that helps us really just keep the needs of Iowans with brain injury at the forefront. And so we help folks with our resource facilitation program with a variety of different issues. So as you can see on this slide, this is just sort of a snapshot of the different things, some of the different things that families call in needing help accessing. And so this is definitely sort of a maze as well for helping people navigate systems that exist in these different areas. So if someone is affected by stroke or other types of brain injury, it's going to be more difficult for them to be able to navigate programs and systems that are out there, especially if they don't have a family member or a natural advocate that can help them with that sort of thing. So that's what we try to help people do. We can help people on phone calls directly with these different organizations, or we can just assist them in getting the information to them, and then we are able to provide follow-up to individuals who call us to make sure that their needs are continuing to be met. So as you can see here, basically we help individuals choose, get, and keep information services and support. So we may meet them where they are, like I mentioned earlier. They may call us initially because they're needing assistance in understanding whether or not they can return to work in their position that they're in. Is that a realistic option? And we can help them understand what resources are out there in the state to specifically assist with how to go back to work following a brain injury or a stroke, programs that are there, and specific direct supports as well. You know, if they're able to get into a position or back to their old position, their needs might change over time. So 3 months later, we might hear from them and hear that they're having specific problems in this new area, and we're able to shift gears and help them with whatever is at the forefront in their life at that point in time. And so we're kind of in the middle between what an INR sort of agency would provide in sort of that one-time information, email or brochures, and then, you know, formal case management. We kind of fall in the middle as far as what resource facilitation looks like and how it assists folks. And so really, you can see it on this slide as well. It's just we're able to help individuals with a variety of different things that might come up. Sometimes we hear from callers and they don't necessarily know how we can help, and they don't necessarily know what they might need. So we have to kind of go through a history with them and an intake to maybe help them even identify what the priorities in their life might be and figure out what resources and assistance we can provide to help them with those things. So the principles of neuro-resource facilitation, it's very individualized. We hear from people with needs across the board. Some people really just need support group information, for example, and other individuals are going to need some more long-term, more frequent support in making phone calls to get connected to services. The brain injury waiver, for example, is a program that exists in Iowa that's a home and community-based service for individuals, and it's become, under managed care, of course, something that is different for people to navigate right now. So we're hearing from a lot of individuals with those services and how to navigate that, how to appeal decisions, those sorts of things. So we can be assisting them on a more regular basis as they need us to, and then eventually we might fall off as far as how much they'll need us. We're very accessible. Really, there's no wrong door to get connected to us. You can call our toll-free line. We have what's called our Iowa Brain Injury Resource Network program, which is over 260 agencies, hospitals, clinics, other types of nonprofit organizations across the state that have our brain injury resource tote bags and other information about us. And so if individuals are accessing a support or a service through this agency across the state, they will then find out about us and get information for us and call us directly that way. We also have what's called a traumatic brain injury, actually acquired brain injury registry now in the state of Iowa that's housed at the Department of Public Health. So any individuals that are falling into diagnostic categories of brain injury and are hospitalized or treated in a hospital setting for that injury, they're going to get a letter from the Department of Public Health with information about us as a resource for them. So they may get a letter that says, we understand that you had a concussion or a brain injury or stroke in the past 6 months or however long it was. The Brain Injury Alliance of Iowa is a support that you might find helpful to you. And so then we'll hear from people that, as a result of that letter. Our organizations, I mean, we're very focused on making sure that what we offer to people and what we connect people to is really directly connected to why they're connecting to us. We want to help them with what they want us to help them with. So it's very individualized and it's very holistic. We try very, very hard to value what our callers value. Like I said here, there's really not any wrong way to try to connect with us. Our toll-free line is listed here. It doesn't look like we have our email address listed here as far as our informational email. I apologize for that, but it's basically info, I-N-F-O, at BIAIA.org. That is just, and you can find that on our website as well. And just send an email there if there's information that you're looking for or have more questions about what we can do. You can contact us that way. You'll also find us at a lot of exhibits throughout the year, trying to get information out there as well. So we try to exhibit at clinical conferences, a lot of other conferences that focus on service delivery for persons with disabilities. And so if you are aware of conferences and events that you think it would be really beneficial for us to be a part of, we'd love to hear from you. We're trying to always expand that outreach across the state as well. Here's just kind of a snapshot of some of the education that we offer throughout the year. I talked a little bit about the research. This is just a little bit of a list out of some of the things we've collaborated with Mayo Clinic on, and we do, as far as policy and legislative advocacy goes, I talked a little bit about that. This shows just a little bit of bullets out some of the things that we've focused on in the past with our big picture advocacy. We do an annual day at the Capitol in February every year. This slide is old, so that was a couple of years ago. But we annually host a day for brain injury survivors to come together in February to be able to have a presence representing the Iowans with brain injury. And these are some of the other groups that we collaborate on. We have a team, like I said, of 6 facilitators, including myself and my executive director. We all sit at a variety of different tables across the state, really pushing for understanding of brain injury and remembering the needs of Iowans with brain injury and how we can together collaboratively with these other efforts make sure that individuals affected by stroke and brain injury are getting the best services and supports that they need. We also participate in some prevention efforts. Some of the things that we are a part of are the Falls Prevention Coalition, and we also participate with the ATV Safety Task Force. You can see some of the other efforts here, really just trying to make sure that brain injury prevention is something that is remembered as well, because really the only way to prevent brain injury is to stop brain injuries from occurring. So it's really the only cure for brain injury. I talked a little bit about the Iowa Brain Injury Resource Network already. We do also have a variety of support groups. I think right now we have 5 or 6 that are directly affiliated with the Brain Injury Alliance. We have a listing of those on our website, and we send out a monthly announcement about the specifics of the location of the support groups that we have. And so if you're not on that email listing, contact us and we can get that information to you of when and where our support groups meet. And we also have done a couple of online telephonic support group meetings for individuals in Iowa, and we're going to be hosting another one of those in June as well. And so we're trying as well to reach those folks across the state that are in rural areas that might not necessarily have access to a support group in their region or don't necessarily feel comfortable in that group setting. We know that, especially like Stacy was saying, some of the younger population especially, they may be more comfortable with more of an electronic support or a virtual support of some kind. We also have a Facebook page that's dedicated to brain injury survivors, and you can find that by linking with our brain injury direct support group, or our Facebook page. And so if you're having difficulty finding that, you can contact us for a link for that as well. Let's see, time. Does anybody have, oh, there's our website and our email address there for you. Does anybody have any questions?
Yeah, so we'll go ahead and give you all a moment to enter your questions, so go ahead and do that. And while you're doing that, I just want to remind everyone, like Brandy had mentioned, if you're a survivor or a caregiver, please feel free to reach out to us at the Brain Injury Alliance. If you are in need of any resources or information, or if you're a provider on the line today, call us if you are interested in any sort of case consultation or needing advice or help or suggestions on where to go with a particular client. So I'll check the questions and see if anybody, it doesn't look like we have any questions right now. So if you do have any questions, please feel free to contact Nicole, Stacy, or Brandy after the webinar. But Brandy, Stacy, do you have anything to say before we wrap up?
No, this, like Annie said, this will be actually living once it's uploaded to our YouTube page. You'll be able to access that, and I believe Stacy's also going to have a copy, so there's going to be some efforts to be able to get it out to different populations affected by stroke. If you have any questions after you've watched the webinar, feel free to contact us.
Well, thank you, everyone. Just a reminder, like Brandy had said, the webinar was recorded. But I want to thank everyone, Brandy, Stacy, and Nicole, for being with us today. And thank you to everyone who was on the line for listening. So thank you and have a great rest of your day.